Hi everyone, I'm Emily, one of the nurse practitioners here at Northeastern Reproductive Medicine. Today I'm going to talk to you about the sonohysterogram. So the sonohysterogram is one of the diagnostic tools that we use here. It's an incredibly important tool that we use to diagnose any uterine abnormalities or structural abnormalities within the reproductive tract. So what we're doing with that test is you will come in, you'll have usually blood work, and then you'll go into the ultrasound room. Our sonographer at that time will do a transvaginal ultrasound where we're looking at the reproductive structure. So we're looking at the uterus, we're looking at the ovaries, looking at the adnexa and seeing if we see anything abnormal. Things that we can see at that point in time are endometriomas, fibroids. We're really looking to see if there's anything that would indicate maybe a structural problem at that point. We're also looking for your antral follicle count, and that's your ovarian reserve. So we want to see what that is, how many of the egg houses, we like to call them, are there. We cannot see the eggs, but we can see those follicles, and that gives us a good baseline for ovarian reserve that month. The second portion is when a provider will come in. What we do is insert a speculum, just like you do a pap smear. So we find the cervix. We then clean the cervix off with betadine. If you have an allergy, we will use an alternative. We use a small catheter to instill saline into the cavity, and then at that point, we're looking for anything within the uterus that might be abnormal. Things that we tend to find are uterine scarring. That can be from previous pregnancies, miscarriages, IUDs. There's many alternatives that can come from. Also, we will see polyps. We can find septate uterus or intrauterine fibroids. So those tend to be the big things that we're looking for and trying to find because those can prevent pregnancy. We're also looking at your tubes. We want to see if those are patent, so fluid going out the tubes, to make sure that the egg can get into the fallopian tube, be fertilized, and lead to a pregnancy. So the biggest benefits of this procedure and testing that we do is to check for the abnormalities. We want to make sure we know before we're doing any treatment moving forward that everything structurally is as it should be. Things to expect, there can be menstrual cramping. A lot of people will experience that. It doesn't tend to be significant cramping. For some people, it will be. We tend to tell you to take Tylenol. That's okay to take before. Your provider can go over that during your consult before you come in for your diagnostic testing. And then after, usually the provider that does the test will give you the preliminary results, what we see, what we don't see. If everything looks normal, that's great. Still that frustration of infertility for most people. But at that point, we'll schedule a regroup with your main provider that you saw from your initial consult, and they'll go over all the results. And then at that point in time, we can move on to treatment. But this procedure, the sonohysterogram, is key to our testing, is key to getting you pregnant, and we really rely on it heavily for moving forward with treatment.